And with a stretched budget, officials say there's often very little money left to allocate to mental health. Many who live below the poverty line are forced onto the street with no hope of care or rehabilitation. They are failed by the health system, rejected by their communities, and ridiculed by the families they love.
From your knowledge of mental health care in Africa, is that the same case across all countries, across the board?
I'm afraid it is. It's a very common picture, and people with mental health problems are subject to gross human rights abuses in many parts, not just in hospitals, but also at the hands of traditional healers and in the community, sometimes at the hands of their own family. The reason why mental health is such a hidden and stigmatised condition is because there simply are not the services available. So the people that we've seen in the hospitals in your reports are the tip of the iceberg. They are the few people who are able to access some form of care. There's a CBM in Nigeria has a fantastic programme treating people with schizophrenia in the community. The psychiatric nurse visits them in their home, provides medication and counselling and family support, and the person remains integrated into the community. And it's those kind of approaches which we need the resources in order to scale up so that many more people have access to that kind of evidence-based treatment.
Right now, there are only 1,200 psychiatrists in Egypt, a country of 80 million people. That means attitudes need to change. One of the biggest objectives of these reforms is for people to start seeing mental health patients as patients and not a guilty secret.
There's a real stigma attached to going to a psychiatrist or seeing a mental health professional. You know, why is that such a hard barrier to cross?
Partly because of our own ignorance about processes. And as I said before, when you have no information, when you're ignorant, then you assign schizophrenia, you assign depression, you assign any behavior you cannot understand to possession by witchcraft or some other demons. And that's your way of understanding and explaining it, and that becomes the official position. So for me, these are positions of ignorance from which we must remove ourselves. It's a major challenge, but it's a challenge that very sadly is spread right across the whole of the African continent. In fact, ironically, Kenya is only behind South Africa and perhaps Egypt in the ratios of psychiatrists that are available per population. There are countries in Africa where there is not even a single psychiatrist to 5 or 6 million people. But the truth and the reality is that very little has been done systematically and deliberately, either by government or by ourselves, to bring up the level of mental health in this part of the world.
Some people might say that, you know, on the scale of things to do, food for the people, basic health care in terms of HIV/AIDS and other serious matters, you know, democratic institutions. Some people might say that psychiatry should be kind of way down the list. Should it be?
Some people will say that, and many people will be able to justify that. Until you give them a few numbers, until you tell the people what it costs to neglect the mental welfare of the people. For example, 25 to 30% of all consumers of primary medical facilities go to consume those services primarily because of mental health needs.
1 in 4.
1 in 4. The reality, of course, is that they get unnecessary blood, urine, and stool examinations at great expense and great wastage. And therefore, whereas you are not expending those funds for mental health services, you are wasting them because you're neither doing physical services nor doing mental health services.
Why should policymakers care about mental health?
There is no health without mental health. And there is no economy, and this has been shown in all parts of the world, that in fact there is a relationship between good mental health and productivity. And the converse is also true. Those people who are mentally unwell do not go to their farms, do not go to factories, do not go to work, and therefore a mentally unwell society is economically unproductive. And therefore, one of the strategies for improving productivity in any society, including the African community, is to treat those people who are going to work, including the young people, make them mentally healthy, and get them to produce. We are losing far too many men and women to mental illness and therefore to unproductivity by not treating them for mental illness.